All right, I'm going to show you some techniques that can help with tension or pain in the lower back. I mean, there's so many things you can do, but here's some basics that one can use to help manage tightness and low back pain. So first of all, if you have a spinal condition, you know, a disc bulge or a herniation, or maybe a facet syndrome or something, if you got some kind of spinal condition, then you don't want to do any foam rolling while you're on the ground, so don't foam roll your back. But we would like to do a little bit of myofascial work, so you could stand up against the wall, use a lacrosse ball, and massage the muscles along the spine out. Then I would also roll your glutes. And you just do this up against the wall. Use the ball. That way your spine can stay neutral and you're not putting shearing forces on the vertebrae. Okay. You can also certainly use a stick and roll those out. Or sometimes I like to take a cup and stick it on my back and then just move. So I would put it on my back. Once it's on my back, I can just do some touches as long, something that stretches my muscles out just a little bit, even if it's just a little reach, just so you can move that tissue while you're decompressing it. Okay, so I got it on the muscles that run right along the spine. You use cups for that. Okay, and then last but not least, you can use a percussion device like the Theragun. Just got to be careful, don't get too crazy with it. And then I'm just going to take it and just gently work those muscles along the spine. Go into the glute, work the lateral hip. I would even go into my hamstrings, and then finally do some calf work, and that release that whole posterior chain to take some tension off that lower back. This is a great tool. Once you get done with your myofascial work, which should be preceded by some belly breathing. So if you're just going to breathe, you're just going to lay on the ground. Keep it really simple. You don't have to get fancy. And just breathe into your hands. Feel your belly expand. Okay? Once you get done with that, you're going to need a strap, a towel. I'm using a band. And then I'm going to wrap it around my foot and then do some hamstring and calf stretches. So I'm going to hold the center, 30 seconds or so. I'm going to go out to the, in this case, my right or lateral, and hold that for about 30 seconds. Notice I'm keeping this foot up. It doesn't have to be in a box, just bend your knee. Try to keep your lower back neutral. And then I'm going to go towards my midline and hold that for about 30 seconds. Make sure you continue to breathe. Okay, so that's some hamstring stretches to reposition. Then I would also maybe do a figure 4 stretch. You can put your foot up on the wall, or just hold it here or pull it up. That's usually what I do, and I'll use my elbow to block that and then stretch that hip. Again, trying to keep my spine neutral. And then the last stretch, the piriformis stretch, I will bring my knee towards my sternum, like so, and stretch that piriformis and the rotators of the hip. And with stretches, I'm going to hold at least 30 seconds or so. Okay, make sure you do both sides. So that's a little breath work, myofascial work, and then some stretching to help manage tension in the lower back, maybe some pain. Do it every day, once a day. Do it after your workouts. All right, good luck.